We start with COVID-19. South Korea has seen a big drop in the number of new infections, partly due to the weekend effect, but also as infections drop overall. And from today, South Korea will implement the latest social distancing measures for the next 2 weeks. Choi Min-jung starts us off.
South Korea reported 127,190 new COVID-19 cases on Monday. The figure fell by a whopping 100,000 cases from the previous day, partly due to fewer tests done over the weekend. However, the overall trend is in decline, with 60,000 fewer cases compared to last week. Currently, there are just over 1,100 severely ill patients, and there were 218 additional deaths. A senior health official said the figures will start to drop after reaching a peak sometime this week or next week. Meanwhile, revised social distancing measures are now in effect for the next 2 weeks. Up to 10 people can socialize in groups regardless of vaccination status, and businesses can remain open until midnight. These include restaurants, cafes, singing rooms, public baths, as well as clubs and bars. Movies and shows at theaters and concert halls may begin any time before midnight, but performances must end before 2 a.m. Meanwhile, restrictions for large events remain the same, with a cap of 299 people regardless of vaccination status. Events with over 300 spectators can be held if there is approval from relevant authorities. And rules remain the same for religious facilities as well, with a 70% capacity limit on all activities and events. Authorities have said they will consider lifting most restrictions, including outdoor mask mandates, if the country's virus situation remains stable for the next 2 weeks. While some say it's too early and unsafe to stop wearing masks outdoors, some health experts say the time has come for people to be allowed outside without a mask, given the relatively low transmission rate outdoors. Starting Monday, local clinics and hospitals can submit their applications to provide in-person treatment for COVID patients. Patients can now book appointments for such treatment and are allowed to visit clinics and hospitals even if they're under self-isolation. Choi Min-jung, Arirang News.